Hi, my name's Jeremy Sachs and I'm an integrated psychotherapist. So I specialise in trauma recovery. I work with a lot of people who are living with long-term health conditions. I work a lot within the LGBTQ community and with young people, but of course I'll see clients from all sorts of different backgrounds. So I've been asked to talk to you about psychoanalytic psychotherapy. So psychoanalysis was established in the 1890s by Sigmund Freud. It has a long and really interesting history. It's full of different people arguing different things, arguing different theories. Some people said, oh, it's a pseudoscience, you can't possibly do rigorous scientific research on that. And other people saying, well, this is going to transform the way we see human beings and their behavior and their feelings. And many different thinkers around it, many different therapists around it. Basically, it's got all the drama you could want. Instead of trying to sum up the different schools of psychoanalytic psychotherapy, I thought what I would do is just summarize some of the things that most psychoanalytic therapists or analysts are interested in when they're in the therapy room working with their clients or their patients. So they are really interested in how adult problems can be traced back to childhood. So they're really interested in primary caregivers like parents or carers, and they're interested in some of those painful memories, but also some of the memories you might forget. So how early experiences can shape your feelings, emotions, and ways of being in the world as an adult. They're really interested in behaviors and how they are affected by belief systems. So to give you an example, let's say when I was really young, I was really emotional. I would cry a lot, I would have tantrums. All of my emotions I would express outwardly. And I had a mum who worked really hard, and she would come home depleted with very little energy to give me. And she might say to me when I was crying or looking for attention or having a tantrum, she might say, oh, just one night off, why do you have to do that? It's like, I'm exhausted, you know. And that might send a message to young me that my emotions were too big. You know, that everything I felt no one person could possibly hold. And that's a belief I could carry with me throughout my life. Fast forward to my adulthood, I have this belief about myself that my emotions are just too much for anybody. And that might present itself in multiple different ways. One, I might run around, you know, really sort of needy, really looking for somebody who might be able to hold my emotions. Or I might decide just to build a brick wall between my emotional self and the rest of the world. And you can imagine how these two different beliefs would affect me while I was dating, while I was at work, my sexual relationships. You know, that idea is gonna really impact my behaviors around that. Analysts are also really interested in the unconscious, and when unconscious ideas sort of percolate up into the consciousness. I'll give you another example. So I run groups for survivors of sexual abuse. Now, often, particularly with early sexual abuse, people tend to take all of those memories and those feelings and put them in a box and just put them away. Just that, no, can't look at it. Too painful, too damaging, too horrible. And they suppress those feelings and they stay in the unconscious. When they get to the groups, they start hearing other people talking about similar sexual traumas, and these unconscious ideas start to bubble up into the consciousness. And what this looks like, this can be bad dreams or nightmares, this could be intrusive thoughts, this could be horrible flashbacks, right? So an analyst will really want to work with these ideas that come from the unconscious into the conscious. Transference. So an analyst really will want to get into transference. So what I mean by that is that when a patient relives feelings or ways of being with their therapist and in the therapy room that maybe belong somewhere else. So a therapist could remind somebody of a really overbearing, critical father. You know, say I had an older male therapist, I could be sitting there going, oh, I feel really oppressed, I feel really criticized, I feel really shamed by this man. And we could find out that actually that isn't what the therapist is doing. It's just there's something about them that is invoking all of these feelings that belong, in this case, to an overbearing father. But you know, this happens with all different relationships in our life, and the therapist will really want to talk about what's going on there. So psychoanalysis has come an awfully long way. What it might look like, you might get a relational analyst who is pretty informal, pretty relatable, you know, be able to like talk about the relationship. Or you might get an analyst who feels quite cold and quite clinical and quite removed emotionally. This type of therapy tends to be multiple times a week, so some people have it 5 times a week, and it tends to be very long-term work. And this is because it's doing such deep psychological work that it requires a lot of attention and a lot of time. I will say it's quite a privilege being able to do that. It's a privilege because, you know, time and money, it costs a lot of both of these things. So if you're like, oh, psychoanalytic theory sounds really interesting, and I'm really interested in all of those things Jeremy's talked about, but I don't have the money or I don't have the time, I would send you in the direction of psychodynamic theory, which is built on the same kind of blocks, but tends to be once a week, maybe twice a week if that therapist will do that, and open-ended, so it doesn't have to be really long term. I will always say whatever type of therapy you go with, and research backs this up, it is the relationship between you and the therapist that is the most important thing, even above the type of therapy that they do. And you can find loads of therapists on Counselling Directory, including myself. So I hope this has been interesting, I hope this has helped, and yeah, thanks.